Hey, it's Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about the informed consent for clear aligners. And if you're doing Invisalign or ClearCorrect, this is ClearCorrect's right here. You can get it through your portal or ProLine or ST Express, and a lot of them, they have their own, you know? You can just get a copy of it, but it's your job to make sure that the patient is signing it. It's really, really important that before you start the case, you make sure it's signed. And as part of the signature, it's not just getting the signature, it's also making sure the patient understands, also that you are pointing out any specific additional risk factors that you see. So you can see here, there's a ton of bullets. I'm just guessing there's about 20 bullet points here, but some of them aren't going to be applicable. And the patient's going to look at this and one of two things is going to happen. Either they're not going to care and they're just going to skim over it and then they're just going to sign it, or they're going to freak out and then they're going to maybe not want to do treatment. So I think regardless, it's really important just to say, yes, this is just a standard thing that we have to do before we do clear aligners, but we want you to understand all the risks. We can't always predict who's going to be at risk more or less for certain ones. But based on your dental health, your oral health, your medical history, and your x-rays, the following I'm a little more concerned about for you. You know, and everyone's going to have one, two, three, a few. Some people might have more. My suggestion is that patient, you should get a copy of this and that you highlight the ones, you know, that are a little bit more concerned. And then you need to document that as well in your chart notes that you went over specifically those ones. That is my suggestion. And then any dialogue you may have had. So I'm going to help you in the scripting. It gets easier with time, but I'm going to help you with the quick scripting on these, the way I would explain it. And I like for the patient to be able to ask questions. And if they see something that bothers them, talk about it, you know? So let's just go over these super high level. Okay, so first one, this is going to be a long video, so feel free to fast forward if you know a lot of this stuff. Treatment time may exceed your doctor's estimates, poor compliance to your doctor's instructions, not wearing aligners, required number of hours per day, missed appointments, excessive bone growth, poor oral hygiene, broken appliances can extend treatment time, which may increase the cost and affect the quality of the outcome. Okay, so this is an important thing here. Because yeah, we can't always predict how quickly a patient is going to go, even if they're the best patient in the world. Sometimes some patients will go slower and sometimes patients will go faster. And sometimes there's no rhyme or reason. It could be based on the density of their bone. It could be based on medication. Sometimes we just don't know, you know. But the main thing is you're telling them it's really important that you follow our instructions, okay? That you have good oral hygiene, that you wear them as directed, and you come to your appointments. And if things are not as so, there could be additional fees, and that you want to illustrate that. I mean, obviously you try to be as flexible as possible with that, but you know, that's kind of the compliance part. You may also want to extrapolate on that and in there put in numbers with that. You know, we estimate your treatment to be X amount of aligners. We're going to have an expiration date on your treatment of, you know, maybe plus 50%. After that point, if due to non-compliance, poor oral hygiene, or missed appointments, there may be an additional fee of X amount per month in treatment, or X amount per aligner, or X amount per lost aligner, or anything like that. I suggest that you definitely have that discussion, and eventually you're probably going to want to come up with a document on that once you've done a few and you've navigated it. Initially, I hesitate to have you be so strict on that because a lot of it might be you and your team kind of not getting used to how things are. So it may not be the patient. And so until you get your confidence up and you start to learn what is the patient, you know, what is this compliance based? Is this based on something else? You know, did I miss something in the medical history? You don't want to be pointing fingers yet because that's a great way to get yourself in trouble. All right, next one. Unusually shaped teeth can also extend treatment time. For instance, short clinical crowns can cause problems with the line of retention. Yeah, so if you have super short teeth or certain shapes of teeth, things can track a little bit slower. You know, again, in time, you're going to be able to recognize these things, and you might choose to either have additional wear or have them wear chewies, or you might choose to put more attachments on it. But initially, you may not notice that. So, and I love to say that the treatment consultants or the treatment planners notice these things, but they don't. Okay, tooth decay, periodontal disease, decalce, inflammation of gums can happen if you don't take care of yourself. So yeah, they still need to go to their regular dental appointments. They still need to have good oral hygiene. They cannot drink and eat with the aligners in. Things are going to happen, you know? And if you're at risk already for tooth decay and gum disease and it's not being treated concurrently and it's not fixed before, these things can get worse. So that is why it's important to come regularly, or at least be checking in with your dentist. You can get sores, but that's pretty rare. I would say a little bit more sore maybe with direct-to-consumer and maybe ClearCorrect than maybe with Invisalign or Proline and some of these other ones with a better scallop trim, but it's a risk. You can give them a nail file or something, a clear one. Initially, you're going to have some issues with speeching. Yes, I mean, they'll get rid of the speech issues within a few days. That's not a big deal. When wearing aligners, you may experience a temporary increase in salivation. Oh, yeah, that's normal. That goes away in a few days. Specifically fabricated engagers may be necessary to complete your treatment. When you are not wearing your aligners, these engagers may feel awkward. Engagers are just synonymous with attachments. So yeah, they might be a little bit rough when you're not wearing your aligners, but you're supposed to have your aligners in all the time, so that really should not be an issue. So that's not a big deal. Any medications you might be taking or medical conditions can affect your ortho treatment. Totally true. There's a lot of medications that directly affect the movement or might give you poor outcomes. So you need to understand what they are. There's a lot of them. Do some research on that. You should know these things. Through uncommon allergic reactions. Yeah, although uncommon. Sorry, this typing is so tiny on this thing, so hard to read. Allergic reactions, I've never seen one, so I'm not really sure. I've seen them in braces. Tooth sensitivity and tenderness of the mouth may occur during, yeah, that's normal. You're going to normally have a little discomfort. It's a heck of a less than you have in braces, like way less. ClearCorrect has more than Invisalign because it's a more rigid material and you're doing 2-week changes, which means a higher force every 2 weeks. Whereas Invisalign has a slightly more gradual step. And so they probably won't feel as much. But yes, if they are noticing this happening, then maybe an hour before they do their change, they should take a motrin or take whatever pain reliever is recommended by their doctor, and then do their change, brush, floss, do their change, and then go to bed. So that's the best way to do it. Usually it'll go away in 2 or 3 days, but everyone's different, right? What else? Tooth sensitivity, bone and gums can be affected. Sometimes their health can be impaired or aggravated. Yeah, I mean, you're moving teeth through bone and gums. So sometimes things can happen. Inflammation, infection, stuff like that. Of course, if the patient's coming in regularly to the dental appointment, it shouldn't be happening. Of course, if the treatment is gradual and slow and low and the forces are really consistent, that shouldn't be happening. But if you've made sure the patient doesn't have active disease before they start their treatment, you've done perio exam and there's not any major pockets, there's not huge amounts of attachment loss, if you have questions on that, you really should be sending your patient to perio and getting a clearance there. I would not be treating if the patient has 4, 5, 6 millimeter pockets or more. I would not. I would maybe start with an SRP in your office, and then do a 1-month evaluation to prove that the health is there before I get started. That's just me. That's what I recommend, or send to perio. And maybe they're not a candidate if they have an infection. Oral surgery may be required to correct excessive crowding or severe jaw imbalances. All risks of oral surgery, such as those associated with anesthesia. Okay, well, we're really not doing that, hopefully, with aligners very much. So I think that's just a standard thing that's in there. Wearing aligners may aggravate teeth. Oh, okay, so yes. So sometimes you need additional treatment afterwards. And sometimes it can make a tooth that maybe had been traumatized, not last. So yeah, if there's a history of trauma, like maybe they got hit in the mouth, they've been in a car accident, and then they decide to go do aligners, there could be fractures or there could be just some type of already trauma that is going to get aggravated once you start moving them. So it is really important to have that conversation with the patient, but a lot of patients are not completely forthcoming with you on that. And then all of a sudden things happen and all of a sudden it's like, oh yeah, I was in a car accident. Oh, okay. Well, you didn't tell me. So yeah, a tooth might die. You might need a root canal. You might need a crown. It might fall out. These things can happen, of course. Again, it's a really good idea to have a really great medical history and a really great dental history and an oral health examination to try to rule these things out and to assess the risk. Because in some patients, maybe it's not worth the risk. Maybe you want to do an implant instead. Existing dental restoration, since crowns and bridges may be affected by wearing aligners, they can become dislodged or require re-cementation. Talk to your doctor because, yeah, and if you need more or different dental work, you might have to replace the aligners, which may cost the patient additional money. So my suggestion is that patients need to go and get all their dental work done, elective or not, before they start their treatment. Otherwise, it might get expensive later. So maybe some work can wait till you're done, like a veneer or like an aesthetic thing, but the necessary work should all be done before you go, including third molar extractions or whatever else needs to get done. Because if you need to do something in the middle of the treatment, you're going to have to rescan, you're going to have to make another set. Now, depending on what type of package the doctor purchased, some packages are unlimited, some aren't. But even so, it's still going to take additional time, resources to go ahead and rescan, refabricate. So there might be an additional fee, especially if the patient wasn't honest to you about some stuff. So it is important to have that conversation. Teeth can super erupt, come out of the gums more than other teeth, if not covered by the aligner. Well, that's an easy thing to fix. Just make sure all your teeth are covered by the aligner. If you're doing a scan, that shouldn't be a problem. It's more of an issue with impressions. Root resorption or shortening can happen during any type of orthodontic treatment, including clear aligners. Shortened roots are of no disadvantage under healthy circumstances, but in rare circumstances, root resorption can result in the loss of teeth. There's no way to foresee this. This is true. During your treatment, and we can't do anything to prevent it. Yeah, there's no way, but I always take a panel ahead of time, and then if I see shorter roots, or if they're a retreatment case, or I see blunting of roots or widened PDLs, I already know that they're at risk, and I'm going to bring this up to the patient. And we're probably going to make sure we're taking progress x-rays every 3 to 4 months throughout the treatment, or at least every 6 months. We're not just going to wait to the end of treatment. So we're going to flag those. So that is important. In the case of multiple missing teeth, it is more likely that the aligner may break. Yeah, because there's going to be load flexing. Contact your doctor if it does. Yeah, that's normal. That's why I like to put in Pontics, because then that stabilizes it a little bit more. Because orthodontic appliances are worn in the mouth, accidentally swallowing or aspirating may occur. Oh, I hope not. They're awful big. That's only if you had a partial one. Though rare, problems may occur in the jaw joint, causing joint pain, discomfort, or headaches. Inform your doctor. Yeah, anytime you're moving things around, these things can happen. I really love masseter Botox. It works really, really well. It works wonders, but it's usually not covered by insurance. It can be expensive, but I'm telling you, it's the most wonderful thing. But yeah, that's normal. So occasionally you're going to have a patient that just can't tolerate it. And that's where you kind of have to bill for services rendered. And it's nice if you've already worked out how that works. Let's see. Results may relapse if proper retainer wear is not followed. Difficulty removing aligners may occur if you have multiple engagers in place or excessive crowding. That's a weird combination. Okay, so basically they're talking about relapse. You need to wear your retainers. Yeah, okay. And remember, if you're getting clear retainers, you're going to need way more than one for a lifetime. So make sure you've worked that out with the patient. How many are they getting? What is your warranty? How many more do they need to purchase on their own? Are you going to have a subscription plan? Are you going to use a third-party subscription service? How's that going to work? Most doctors are not going to keep giving patients retainers for life. That's an additional thing. You're going to get a set of retainers, and you're going to strongly recommend that they have a couple backup sets. They come in on a regular frequency, but how and when and how you warranty these things should be at least a verbal conversation or in writing. So that's something, again, with time, you're going to experience, and you're going to figure out how you want to do it. There's no wrong or right way to do this. So, and if you watch some of my other YouTube videos on retention, I've got tons of them and lots of good suggestions. But yeah, the main thing is clear aligners don't last a lifetime. You're talking, if the patient is in their teens or 20s, you're probably going to need 5, 6, 7, 8, 9 sets of aligners throughout a lifetime. And anytime the patient gets a new fill or gets a new crown or loses a tooth, they're probably going to need new ones. So, pretty convenient if they can keep coming in your office, but they may not. So they need to realize how that works and where they can go for that. So anyways, that's pretty much it. Hopefully you enjoyed this very high level overview of informed consent for clear aligners. All right. Thanks so much.